Sometimes families don't struggle because they don't love enough. They struggle because the medical plan and their personal values no longer align, and no one has helped them see that clearly. In the last video, we talked about matching medical treatment to what actually matters. But alignment is not a finish line, it is the beginning of a plan. Today, we're going to talk about how to prepare for what might happen next so you are not caught off guard in the middle of the crisis. My name is Judy. I'm a caregiver educator and a DNP prepared hospice and palliative care nurse practitioner. I created Care Navigated because I saw how often families felt overwhelmed by medical decisions, even when they are doing everything they could to help someone they love. I'm also a caregiver after my mom had stroke and later had to be placed on dialysis. I learned firsthand how confusing it can be when plans shift and no one explains what that means for real life. This video is for education and support only. It does not replace medical advice from your healthcare team, as they understand your loved one's condition best. In my work as a caregiver educator and a hospice and palliative care nurse practitioner, I've learned that families don't struggle because they don't care. They struggle because no one slows things down enough to explain to them what this decision really means. The method I teach here is adapted from real clinical framework used in serious illness care. It helps caregivers understand what's happening, clarify what matters most, and match medical decisions to those values so choices feels less confusing and more grounded in what matters. If you ever felt like the medical team keep offering treatment and you keep saying yes, but something inside you still feels unsettled, you're not confused. You're likely noticing that what's being offered and what truly matters to your loved ones may not be lining up. And that does not mean you're giving up. It means you're thinking carefully. This video focuses on step 4 of the Care Navigated method, match. Match means asking, does this medical intervention actually support the goal we just clarified? Not, is this treatment available? Can we technically do this? Is there still something left to try? But does the treatment move us closer to what matters most? If the goal is comfort, does this intervention increase comfort? If the goal is more time at home, does this plan realistically support that? And if the goal is function, does this treatment restore meaningful function? Match is where confusion turns into clarity. I once met a family whose loved one was on multiple forms of life support. When I asked them what they were hoping for, they said, we just want him comfortable. We don't want him to suffer. But at the same time, he was receiving aggressive interventions that were increasing discomfort, not decreasing it. No one had helped them slow down long enough to see that disconnect. When we gently walk through each intervention and ask, is this helping the goal you just described? The room became silent and very quiet, not because they were giving up, but because they could finally see the mismatch. And once they saw it, the decision felt less chaotic. Here are 3 questions you can use to practice match. What is the main goal right now? How does this treatment support that goal? If it doesn't, what would better align with what matters most? You're not refusing care by asking these questions. You're refining it. Match is not about doing less. It's about doing what fits. It's about reducing unnecessary suffering when the body is already telling you something. It's about courage, not surrender. And when treatment goals align, family feels steadier. even when outcomes are hard. I created a free caregiver decision guide to help family organize their thoughts before these conversations. It walks you through how to think about goals, questions to ask, and how to prepare for conversations with the healthcare team. I've put a link below in the description so you can download it. I've also created a more in-depth caregiver decision toolkit. The toolkit includes step-by-step decision framework, expanded conversation scripts, worksheet for hospitalization, medical decisions, and end-of-life care, and guidance for navigating complex family dynamics. It is by no means a medical advice, but it is a decision clarity grounded in real clinical experience. In the next video, I will teach you step 5, plan and support, how to turn alignment into clear, survivable plan for your family. If this kind of guidance is helpful, I invite you to subscribe so we can keep building this clarity together. Have you ever agreed to a treatment plan and later realized it didn't match what you were hoping for? I'd like for you to leave me a comment down below. You were not wrong for asking hard questions. You are not difficult for wanting alignment. And clarity is possible even in the middle of complexity.